We're here in the offices of Dr. Craig Ziering. Good morning, doctor. How are you?
Good morning. I'm great.
And we're here because you might have seen him on Extreme Makeover. He does incredible things to patients who are follically challenged, okay? I'm among them. This hair, you love it, is out of box. Okay. Now, Rick, you're here because you're missing a little bit.
That's right.
And you've decided to do what? You look right, tell him right there, Rick.
I'm going to have some grafts done by Dr. Ziering.
And why now? What happened?
Well, just it's time to look younger, I guess.
Okay.
Yeah.
You want your hair back?
I want my hair
I
back.
understand. I want my hair back, too. Well, let me show you the kind of work Dr. Ziering does. Now, we're not going to get graphic here because we know people are eating breakfast, but they've got him all prepped and ready to go.
Yes, he's ready to go.
All right, but let us show you what goes on here. Now, this is the first before and after we want to show you of a gentleman who was on before and after. Now, Dr. Craig, what happened to him there? You made quite a difference in what's going on with his scalp up there.
Yes, he had lost a lot of hair in the front half of his head, and what we did was transplant with about 2,000 follicular units all into the front half.
And how long did it take for that to grow in like that?
It takes about 6 months, and it'll continue to get better for up to a year.
All right, now, doctor, I'm going to show you something. Now, everybody knows I'm follically challenged because of this. A little street luge segment I did a couple years ago where the TV hair just, I didn't fasten my helmet. Boys and girls, this is why you must fasten your helmet if you're going to do any extracurricular activities. But I know you're wondering, Gail, what's up? What's with the wig? Well, let me show you. Dr. Ziering has a patient who has what I have. Here's her before and after. Her temples, her hair is gone. I have what they call traction alopecia, which is, tell them what causes that.
Yeah, traction alopecia is caused by pulling or from braiding really tight or any kind of trauma that happens to the hair. Weaves, exactly correct.
I had some weaves. I was wearing weaves for a while, cornrows, and I would pull the hair back in a braid, and eventually my temples look just like that woman's temples. But her hair is amazing.
Thank you very much. Yes, it can be restored.
Now here's Paula. She had a similar condition. Here's her before down here. Again, temples. We women, what is going on with us with the temple problem?
Yeah, over 25 million women suffer from hair loss, and it's often in the temple areas and sometimes up in through this area as well.
All right, let us show you Paula's before picture here again. Now, here's Paula at the top of her head. Honey, what happened?
For 5 years, I lost my hair. I take a shower, and I say, Jesus, yeah. I say, what happened? So I'm looking for the right doctor, so finally I'm finding Dr. Ziering.
And just hold your head over so they can see on camera.
That's
wow.
A lot of hair there.
Where does the hair come from, Dr. Ziering?
Dr. Ziering, can you hear him? He wants to know Carlos wants to know where the hair comes from.
Well, the great thing about this is the patient is both the donor and the recipient. We take the hair from the back here.
Now, can you see where that comes from? I always wonder whether you can see where the hair comes from in the back.
Obviously, you can't see it here, and even if we lift her hair up, you can't tell where we're taking it.
It's easier to do for a woman because, obviously what about guys? Do we have enough hair back there and over here and over there to fill in
hair on all sorts of places?
Absolutely. It's amazing what we can do. It's an illusion, but we recreate a natural design by the orientation, angulation, and direction that we do the hair with.
Okay, so here's the next question. In the meantime, before it grows in nice and thick, does it look a little odd? Does it look like you're in the middle of the process?
Actually, after about a week or so, it heals very, very well, and you're able to see, you see virtually nothing, and then it starts with baby fine hairs, which continue to get thicker and thicker. So people don't really know you're going through the process.
Interesting.
And that's why Rick's doing it at a good time, because no one will know he's going through the process.
Okay, now there's a reason why, I'm sorry, Gail, but there's a reason why, let's say I lost my hair in a particular spot. You replace it with hair from back there or whatever. What is the success rate that it's going to last?
It will definitely last. The reason that you lose it generally is genetic hair loss. And what happens is this hair is not programmed to be lost in the back. So we can rearrange it, and it'll grow forever.
Will we lose it again in that spot, though? In the place that you've just
No, you won't lose it again because that hair is not programmed to be lost. It doesn't get the message that it should fall out. So it stays and grows.
That's what we want to know. And one we got so many questions, but before we get there, what about guys who want to, I want to lower my forehead.
You want that Wolfman look, huh?
But all of a sudden you get those implants. It looks like a row of dots there. That
doll's hair.
What you're talking about is the doll's hair and the old plugs. But now what we do is microscopic follicular unit grafting. My best work goes unnoticed. You won't be able to tell.
And can we just show you? We're not going to talk to Mike yet, but look at this is Mike. Hi, Mike. Can I touch your hair?
Absolutely.
Do you see any dots up there?
Nope.
Anybody?
No, that's very natural.
Dots up there.
We're going to talk to him next hour. All right.
This is great, Gail.
Really
loving it.
Try
we're loving you.
I
just want to know the cost.
Carlos wants to know the
that
cost.
next hour. Oh, wait. Carlos wants to know what?
The cost, the average cost.
Carlos wants to know average cost.
The average cost, it's anywhere from $4,000 up to $10,000 if you need a lot.
Okay.
All right, now let me give you some information, Doc. We're going to let you go back in the room with Rick because he's getting ready to get Rick ready for some hair.
Yeah.
All right. He's going to do a surgery here. He's going to do a procedure here. Again, we're here at Ziering Medical in Beverly Hills on Wilshire Boulevard. There's the phone number, toll-free website. And as you can see here, he's getting ready to flip. Rick, you ready for this?
Yep, I'm ready.
Come on, Rick, go for it, Rick.
What is the procedure we're doing here? We're just doing hair transplants, the flicker?
Yeah, he's going to transplant hair from the back to the front. Now,
Okay.
we're not going to show you all the little graphic stuff.
we want to
Go
see
for it,
it.
Rick. No, we can't. We
But,
got to go. We got to go.
Doc, are you
We'll
ready?
get more next hour. Yeah, this is really interesting
These are the
stuff.
questions that I've always wanted to ask, but didn't feel like it was necessarily polite to do.
Very good. Yeah.
Okay.
It says here in the ad, intercept your baldness before it goes too far. That's his ad. That's his ad this morning.
I'm Gail Anderson in Beverly Hills with patient Mike Caudell, who is celebrating his first Valentine's Day, month, with hair, a patient of Dr. Craig Ziering here at Ziering Medical. And we'll find out what you can do if you're a little lacking on top. Isn't that right, Doc?
Yeah, but I'm good, but I'm not a miracle worker.
Okay, details in a live report. Yeah, that is pretty bad, huh? Wow. We're here at the offices of Dr. Craig Ziering, Ziering Medical. We're in the middle of a hair transplant procedure with Rick. Rick, how you doing, baby?
Super duper good.
Unbelievable. He is all numb. We're here with Dr. Craig Ziering, and you are now doing what, Doctor?
I'm creating the recipient sites.
So behind Dave Lopez is the hair you have, I don't want to say harvested, but extracted from them?
Yes, we took the hair from the back of the head, and now we're cutting it under the microscope. This is the microscopic flicker unit part, where we divide them into little units, and so that we get individual groups of 1s, 2s, and 3 hairs the way they naturally grow, so you don't get that pluggy look or the doll's hair that people are all worried about.
Wow, amazing. All right, we're going to let you pick, what did you call it?
Make the recipient site.
Recipient sites. All right, we're going to stop that a little bit because we're going to show you the result of this kind of work. Now, here's the before and after. We're trying to show you all types, African-American men, women. This gentleman had a little hair missing in the front there. And again, Dr. Ziering transplanted hair from the back to the front. And there's his result. Now, this is interesting. This is a young girl whose hair was missing in an irregular pattern in the front. What was that? She had a spot here missing in the front, on the side, but you made it all good again.
Yep, we were able to put it all together, and that was from, she was plucking the hair out. She was pulling it out.
Oh, my goodness. Now, here's another young lady, because we've heard these stories of young girls pulling their hair. Either they're nervous or it's just a nervous tick or something. Oh, she almost pulled her hair out. She's almost bald in one spot.
Yeah,
We'll still help her.
Yeah, we call that trichotillomania. You have to stop
What do you call that again?
It's called trichotillomania, and it has to be stopped first. And then what it leaves you with is a scarring alopecia or scarring hair loss, just like you had a burn or some other trauma, or even the same kind of traction alopecia you get from the braiding or the weaves that are too tight.
Wow.
Okay. Now, here's Paula, and for folks who missed her last hour, this is what was going on up here. Thinning hair after treatment. And just so you know, that picture isn't airbrushed. Doctor, go ahead and run your hands through there. How's that feel, Paul?
I feel great.
All right.
I like it, too.
All right,
and
I've got
then-
a question.
Yes, ma'am. Can we show you Mike?
Yeah.
Yeah, go.
All right,
Let's see Mike.
Because Mike kind of looked like Greg Theroux before he let it go too far. After his treatment, and unbelievable.
looked good.
Year. I don't want to bring him up because it's a year today.
Today, it is a year.
Happy
Absolutely.
Valentine's Day.
Thank you very much.
How do you feel about this?
Awesome. It's a wonderful experience.
Any pain?
No pain at all. I was back at work on Monday. Took a Friday.
All right, Michaela, you want to ask?
I want to know, I know this sounds really dorky, but could I, for example, let's say Carlos needed could I, donate my hair? I mean, it has to just be living hair, is that correct? Or it has to be from the same person's...
Yeah, that's an excellent question, but it is an organ transplant. The hair is an organ, so it really has to come from the same patient. So the patient is both recipient and donor, and I'm basically in the moving business. I move hair from the back, put it on the top and to the front.
Well, because you hear about heart
I'd look good with your
transplants.
hair.
You look great with my hair.
But you know, there are a lot of people that are candidates that just don't even realize it. We saw the luge incident.
All right, for folks who don't
How
know.
about
when I was
hair
doing
from
this-
other parts of the body?
Okay.
Well, again, that's an interesting thing. We do take hair and we put it in the eyebrows, mustache, beards, and so forth. People can take hair from other areas. They've asked about doing chest transplants and actually taking some hair from the chest or even the back. But you have to think about, to get that fine scar in the back, you have to take it from an area that's really dense. And that's why the back of the head is the best donor area.
You made a very good point. You could actually implant into eyebrows because a lot of people have really thin eyebrows.
Absolutely. We do it very commonly.
What prompted all of this was her little ride on a luge. Let's take a look at Gail on the luge.
And the TV hair, what I call TV hair, fell off. Doctor, that's where I keep going, but the hair is,
stay behind.
On the street because I've got traction alopecia in the temples. And you took a look. What do you think? But you see, this is what's going on. The braiding, can you see? And the weaves have pulled my temples out.
Yeah, and absolutely, you're a perfect candidate for the procedure because we looked at your donor back here, and you do great. We could fill this area in, and you do extremely, extremely well.
All right, and what about Greg Theroux, who, I'm teasing him, but we're both in bad shape here.
And the truth is, people get teased about it a lot, but there is definitely hope. This hair in the back, which you're shaving, this is all good donor hair. And so while we're not going to give him a full head of hair like he had when he was 18 or 20, that's not the goal, but we can give him, and if we'll turn you around for a second, we can give you hair that reframes your face in here and looks very natural. So there is hope.
Okay, all right. Here's where we are. I told you, hair for Valentine's Day. You thought I was kidding. All right, we're here at Ziering Medical Center. We're going to let the doctor go back to work and finish up with Rick here. There's the phone number and the website. Rick, we're going to follow you and come back and check on you in a couple months to see how you're doing.
Gail, it's like buying carpet because we wanted a price, but how much, like when you buy carpet, the only way you compare is by square foot. How much per graft?
Well, it actually varies, but it's anywhere from, it averages about $4 per graft. It's $3 to $5 depending on the volume of hair that you're having done.
We have so many questions, but we'll check on your website and also our website.
We're going to follow up here.
Yeah, we'll see him again.
Yeah.
Okay, we'll see you in a couple months.
You guys.
You got a lot of prospective clients here.
Yeah.